Good afternoon, everyone. I'm Dr. Morgan Crossman, and I'm excited to welcome you to the State Advisory Council's meeting for the month of July. And I serve as Building Bright Futures Executive Director and leader of the State Advisory Council, and we're really excited to bring partners together today. We have a really fun agenda where we'll be hearing about one of the spotlights from the Vermont Early Childhood Fund, really focused on the Bennington Vision and Hearing Screening Project. We will be hopefully and excitingly nominating and voting in Susanna Davis, who's the Director of Racial Equity, to the State Advisory Council in an at-large seat. And then I imagine that folks are really excited to have a discussion about Vermont's childcare and early childhood education systems analysis. So part of our day today will include having a robust discussion with the State Advisory Council. And I do want to talk a little bit about some housekeeping items throughout today's meeting. We're going to have a slightly different format in how we're running. So we do want to ask that for the duration of the meeting today, the board members, so our State Advisory Council members, that you keep your cameras on. And if you're not a member of the SAC, I'd like to ask you to turn your cameras on until the public comment period at the end and when we break into small groups. So over the course of the meeting, we want you to feel free to use the chat function throughout the meeting to be able to engage and pose comments and questions. And we will be, for the first time this year, having a public comment period at the end of the meeting. So in terms of being able to have our public partners and community partners across the state be able to engage with the board, we're going to host approximately 10 minutes at the end of the meeting to give an opportunity for members of the public to elevate any questions, comments to the board around any priorities that you'd like to put in front of them. We're hoping to have approximately 5 people in that time frame and 2 minutes each. So if you're interested in speaking during that public comment period, anytime during the meeting today, can you send a message directly to Beth Trzanski, BBF's Deputy Director. Just a quick note about that public comment period. It's not going to be question and answer. So we are not going to have the board directly respond in that moment. We're going to capture any of those questions and then make sure that we're elevating them through our essential questions and monitoring tracker. So I'm going to turn it over to Beth Trzanski to do our mindful moment, and then we'll keep posting in the chat some of those directions over the course of today's meeting. So thank you for being with us.
Thank you. Good afternoon, everyone. I'm just going to walk us through some mindful breathing. If anyone would like to turn off their video to do this privately, you're invited to do so. Invite you to close your eyes, sit up nice and tall with your feet on the ground and hands on your thighs. Feel your heels, your toes, bottoms of your feet. Feel the bottoms of your hands just resting on your thighs. Relax your shoulders. Relax your jaw. Breathe in, breathe out. As you breathe in again, take a little bit longer to exhale. Let's inhale again and exhale just a little bit longer. Thank you. I'll invite the SAC members to please turn your cameras back on. Just reiterating what Morgan said, we're trying to build our connection in this virtual space, which is hard, so that SAC members can identify each other and be able to find each other on the screen. So thank you. I also want to invite Jenny Moon to turn yours, hey Jenny, thank you, your video on. So we just want to take a few minutes at the beginning of the State Advisory Council meeting to bring some attention to a really cool project, which is, as you may be aware, Building Bright Futures developed the Vermont Early Childhood Vermont Early Childhood Fund in FY22, which awarded $100,000 to community partners with innovative and practical solutions to priorities and gaps identified by our 12 regional council network. And today we wanted to highlight one of those grantees, which is the Bennington Vision and Hearing Screening Project that Jenny, I remember Jenny talking to me about this project years ago saying, I have a project I really want to get funded. And at the time there just wasn't the funds. So thrilled that this project finally got funding to purchase equipment, and she'll talk to you about that. So I'm going to hand this to Jenny Moon, who's the program coordinator for Children's Integrated Services, the early intervention program in Bennington, to talk about who she is and the project. And if we have time, we'll provide a little bit of time for Q&A. So go for it, Jenny.
Hi, everyone. So I am Jenny Moon. I'm the program coordinator in Bennington for early intervention. We are actually located at the hospital in Bennington. So SVMC is where we're housed. So I was so excited when there was funding available, because I've been wanting to do this for a long time and I just never could figure out where to get the money to do it. But we looked into doing vision and hearing screens for the children that are referred for early intervention services. So our high needs population, children with autism, children with Down syndrome, children with significant genetic disorders or global developmental delays. Many of them do get followed by an audiologist and ophthalmologist, but there are those ones that the lack of transportation, the inability to get to different specialty providers, which we support all of that as well. If we need to get them somewhere, we help, with gas cards and this and that to get them to where they need to be. But this was to initiate that vision and hearing screen right off the bat as soon as they get referred to us. So we were able to purchase a spot screener, which I don't know if everybody knows or familiar with the Lions Club, who goes around to the school systems and does the vision screens for the older children. So this is the same equipment that they have. And we're able to use it for a child that is 6 months and older. So every child that gets referred to early intervention, we're able to go out, we have the parents sign consent, and we go out and we screen their vision, their hearing, and we also do a full developmental assessment. So we're kind of doing a whole big package all at once for the parent, and identifying if there is any vision or hearing impairment or concern, that we can make those referrals right away to a specialist. Of many of those kiddos, we have a lot of kids with speech delays and they've never had their hearing checked, or they have tons of ear infections and the primary care doctor hasn't sent them to an ENT yet or an audiologist. So we kind of can be that first step into screening and identifying, and then helping get them into the specialist that's needed. We see a lot of children. So I was going to give you some numbers. So as of on 5/25, I had to do my 6-month assessment for the BBF for when we got the funding. And at that point, we had 173 children on a 1 plan, which means that they were getting services through our program. So whether they were getting developmental therapy, occupational therapy, speech therapy, vision, hearing, whatever it may be for their services, they were on a plan and we were monitoring their vision and hearing. We're also implementing that every year that we check each child that's on a plan. So they will continuously get monitored. Because vision does change, hearing does change, it can fluctuate. And then we got the equipment in February. So February to May 25th, we screened 96 children. And at that point, we had 6 of those children failed in both ears or 1 ear. And then we had 8 recommended for further assessment of their vision. So those children identified out of that 96, we help support them get to an ophthalmologist, whether it be here in Bennington or Dartmouth or Albany. We also have a lack of those providers in this area. So that's another reason we push to really have this equipment so that we could identify children and then support them in order to get to the specialty providers. We screen them anywhere. So whether they're home, childcare, outpatient, here at the office, wherever the child is, we will go and we will use the screening equipment. It is the same equipment that Early Head Start and Head Start uses. I saw somebody wrote that in the chat. I don't have the chat up, but we have the same equipment. So we are using that equipment on a regular basis. I've trained my entire staff, so it's not just me being able to utilize it, it's all of us. So everybody takes the equipment depending on which kiddos they're seeing and will screen. And we're just super excited. We're the only region in the state that's utilizing this equipment for early intervention purposes. I'm hoping that in the future that the state will see how imperative this is and will allow other regions to get this equipment, because it's easy, it's quick, we're identifying kids and we're getting them faster into specialty providers and glasses if they need them. A lot of developmental delays, it starts where you can't see. A lot of the kids that aren't walking, aren't crawling, aren't developing their gross motor skills, aren't able to walk upstairs. A lot of that has to do with vision. Speech has to do with hearing. And we have a lot of children receiving speech services, lots of kids with ear infections, and identifying those needs earlier in order for them to get tubes or, whatever they may need is really going to help prevent having so many kids on one plans and so many kids that are having different things going on that nobody knows about, because the child might not be able to say, I can't hear, I can't see. So all of these things that we're doing is preventative, and I really feel like it is making a difference here in Bennington. Does anybody have any questions? I know that was just a brief overview.
that was perfect. Thank you, Jenny. Really exciting. So yeah, do any SAC members have any questions or reflections? Yeah, Jessica, if you want to introduce yourself.
Thanks. This is Jessica Brumstead. I'm a state rep from Shelburne and a member of the State Advisory Council. Jenny, that was great and really interesting. I have a great nephew actually that found out that he was profoundly deaf as when he was born, because the hospital did this sort of testing. And I'm just curious, does that I thought that happened in Vermont, and are you catching the kids who aren't in a hospital where they have the opportunity for that?
So they do get a newborn hearing screen where they pass or they fail. Many children do pass, but hearing is something that really changes and fluctuates on a regular basis. So you could pass the newborn hearing, but at 6 months, you might have had 3 ear infections and fluid that comes in and out. With that comes conductive hearing loss. So if there's fluid within your ears, it's like you're talking like this, and the child isn't hearing to their full potential. So hearing is something, it changes on a regular basis. And it's something that doesn't get identified as quickly as you would hope. And a lot of pediatricians and primary care doctors, a lot of kids here's one ear infection, a month later, here's another ear infection, or they have an ear infection for a month because the antibiotic didn't work. We have many, many families that we get referred and they go, oh, my child's had 10 ear infections. And I'm like, your child's only 1. What? What are we talking about? I said, have you seen an audiologist? And they're like, no. And I'm like, you're going to go to an audiologist, okay? And they're like, yes, please. So the hearing is something that, yes, they do screen at newborn, but there isn't any, unless you have a history of hearing loss within your family, or there's something identified in the doctor that gets sent to the health department for them to follow up on your child getting regular hearing tested. Otherwise, that does not happen after that newborn hearing screen.
That's great. Thank you so much for that information.
Yeah.
Cool. Any other questions for Jenny? Yeah,
we've also been, I know somebody said the early childhood special educator is thrilled that we've been, a lot of childcares in this area have asked me to come out and do some of the children in their childcares, the home childcare providers also, which the Lions Club doesn't go to the home childcares, they do go to the big centers for the vision. So we have done a few days where we're going to the different childcares to help kind of support them, or if a child isn't there during the time that the Lions Club is there, like we can just pop in one day and just do it. It takes a very short amount of time. It's very quick. It's very easy. And we always have the ability to go back if the child didn't participate. So it's been really great down here, just community wise, because everybody is reaching out and asking, can you pop in and check this child? The child's not doing A, B, and C, or the parents are requesting it. We're also going to hop onto some play groups that are done by Sunrise, the parent-child center here, and do some of the screenings for those children that don't attend any childcare. So we are definitely kind of branching out now that we have the equipment. It's been 7 months, and we're starting to kind of branch out to different areas to get those other kiddos checked that are might be home with their parents instead of in a childcare or something like that.
Excellent.
Thanks, Jenny. That was really exciting to hear. My question was similar if you were partnering with childcare, but also are you partnering with homeschoolers? And a lot of our public schools also have, not all of the schools have the Lions come and do the assessment. So I wonder if you're partnering with them in Bennington too, the early.
Yes.
Yeah.
Yeah, so our services are primarily birth to 3. I was just out of childcare and I did do the school agers during the summer. They asked if we could do them, so I did them. So I haven't necessarily partnered with school systems because the Lions Club really does do that. Like they set up dates and they kind of go through all those children. And the SVSU down here, which is one of the largest school systems, they have an audiologist on staff. So that's, we all kind of work together and partner. But I basically focus on the little ones because that's kind of where our primary goal is to get those. And once they're identified, then they're going to be followed throughout the rest of the time. So my whole goal is to identify them as early as possible. So then they can be tracked and followed by an ophthalmologist or an audiologist, and that hopefully will follow them to the school.
Thank you.
Dimitri, you have a question if you would introduce yourself.
Yeah, hi, Dimitri Garter. I'm the business rep on the State Advisory Council. So, and also from Bennington. So hi, Jenny.
Hi.
You just touched on my question. I'm always interested in how we measure outcomes. And part of the challenge with childcare is the measurements are decades sometimes. But I'm thinking that there might be some shorter term metrics that interventions like this might be measurable. So can you talk a little bit about that?
Yep. So right now we're really measuring the number of children that we're able to screen. And then I'm measuring the number of children that we're actually getting the follow-up services. So one of the issues here in Bennington is that there is a lack of follow-up because there is no ophthalmologist or an audiologist in this area that will see pediatric patients. We do have, advanced eye care. We have some of these other services, but it's very difficult sometimes to get them seen. And then because they're not pediatric, there's not that follow through that needs to happen. So a lot of times they don't get glasses or they don't get tubes, and they continuously say, come back in 6 weeks, come back in 6 weeks. That time frame of where we're identifying these kids is so imperative that they get what they need for corrective purposes so that their development can go and they can reach their full potential. So my biggest thing here is trying to measure that. Basically, I'm going to end up measuring the lack of that and then trying to make the kind of argument to, a bigger place that we need to pull these pediatric specialty people here to Bennington because we have a high number of children that need these services, and we need to give them, all the opportunity to grow and develop to what they need to. So I do have some specific kind of numbers, location of where we're doing these screenings, how many kiddos we're seeing at home, how many kiddos we're seeing in childcare, how many kiddos need that further follow-up. So at the end of this, we do another report for BBF for getting the grant. And that will show kind of all of our numbers. So how many kiddos did we screen in a year? How many kiddos did follow up? Where did we screen these kiddos? Who failed, who passed, and then where did they go for follow-up? So that'll be hopefully the last report. We'll have all that information, and then my goal is going to be probably the lack of the follow-up, which is then going to be the argument that we need these pediatric specialty people here.
Thank you so much, Jenny. I just wanted to mention to State Advisory Council members who may not have been as involved in the Vermont Early Childhood Fund so far, but our regional councils have come together and set priorities and have identified the gaps, the biggest gaps and challenges that kids, families, early childhood educators, providers face across the state of Vermont. And the awardees have identified really amazing and incredible ways and innovative ways to try and meet and fill those gaps. So we're really excited to have Jenny here to talk about one of those, but are hoping that over the course of the year, we can continue to spotlight what this work looks like across the state, and that you're able to hear some of these challenges and figure out whether or not there's a statewide strategy or solution to help fill some of those gaps as well. So thank you.
Well, thank you, Jenny, so much for joining us and sharing
you.
really interesting work. So we are going to transition. I'm going to hand this to one of our co-chairs, Cheryl Wilcox, who's going to do SAC roll call. As we said at the top of the meeting, we're trying something different, which is to encourage SAC members to keep your videos on if possible, and asking non-SAC members to turn our videos off. Cheryl will go through roll call, and non-SAC members, please feel free to make an intro in the chat bar. So I will turn my video off and hand it to Cheryl.
Thank you, Beth. Hopefully everyone can hear me. Just looking for a couple. Great. Love it when there's spaces to get head nods. So Cheryl Wilcox with Department of Mental Health. I'm the Interagency Planning Director, and I'm just going to go through our SAC members. So if you can unmute and just say hi, that would be lovely. Renee Kelly, I saw you, Head Start Collaboration Office. There you are.
Hi, everyone. I am here, Renee Kelly, Director of Vermont Head Start Collaboration. I apologize if I'm going off camera. We've got a storm blowing through and it's getting dark, so my internet could be a little shady, but great to see you all today. And thanks to Jenny, too, for a great presentation. That was a really great way to start the meeting today.
Thanks, Renee. Kate Rogers from the Agency of Education. This is where I start flipping through. I believe Kate may be out today. If she does pop in, get her. Ken Jones from the Agency of Commerce. I did not see Ken either. Sarah Truckle. I know I saw Sarah Square from our Secretary's office.
Hi, everyone. Sarah Truckle from the AHS Secretary's Office. I'm the Director of Program and Strategic Operations.
Thank you, Sarah. Kendall Smith from our Governor's Office.
Kendall was unable to attend today. Thanks, Cheryl.
Thank you. I see Sheila Duranlo, who is Director of Programs for Child Development Division, and for Miranda Gray, our Deputy Commissioner.
Yes, thank you so much, Cheryl. I'm Sheila Duranlo, and I am here representing Deputy Commissioner Miranda Gray, who is traveling to an out-of-state conference for this week.
Thanks, Sheila. It's great to have you here. I also am fairly certain I saw Janet Kilburn, who I think is here for Maternal Child Health for Elisa Stahlberg. Janet, is that true?
Yes, I'm here. I'm like Renee in a big thunderstorm, so having internet problems. I'm sorry, so I might keep my video off, but happy to be here for Elisa on MCH. Hi.
Thanks, Janet. Yes, I love our storms and internet. Representative Jessica Brumstead.
Hey, I'm here. You saw me ask a question, so thank you.
Thanks. Becca Webb, Act 166 Coordinator.
Hi, all. I'm here and happy to engage in this conversation.
Senator Ruth Hardy.
Hi, everybody. I'm Senator Ruth Hardy from the Addison District, and at least for now, the Vice Chair of the Health and Welfare Committee. So nice to be here. Thank you.
Thanks. Amy Johnson with the Parent Child Center Network.
Hi, everyone. Amy Johnson, Parent-Child Center of Northwestern Counseling and Support Services, representing the PCC network. Nice to see everyone.
Thanks, Amy. Eddie Gale from the A.D. Henderson Foundation.
Eddie's at a national conference today, so he submitted his vote in writing.
Lovely. I saw Mike McCraith from the Vermont Principal Association.
Hi folks, Mike McGrath, Associate Executive Director at the Vermont Principals Association. Thanks for having me. Looking forward to today's discussion.
Great. Christy Swenson from Capstone Head Start. Alexis Duquette, who's a parent representative. Here you are, Alexis.
Hi, thanks for having me. I'm in the thick of motherhood, so my camera is off as I have kids all over the place.
Thanks, Alexis. Dr. Ashley Miller from South Royalton Health Center. All right, moving on. Janet McLaughlin, are you there?
I was ready and then I wasn't listening. Hi there, Janet McLaughlin, Executive Director of the Vermont Association for the Education of Young Children, for the largest association of early childhood educators in the state.
Thank you. Paul Dragon from Champlain Valley Office of Economic Opportunity. I'm pretty sure I saw your square, Paul.
Thanks, Cheryl. Hi, everybody. Paul Dragon. I'm with CVOEO. I'm the Executive Director. I do need to keep my camera off. I just had some minor surgery and I've got bandages everywhere. So thank you.
Nice to be able to hear you, Paul. Glad you're here. My co-chair, Flor Diaz-Smith.
Hi, everybody. I'm here at Vermont School Boards Association. I'm the Vice President. Excited to be here with you guys today.
Heather Wilcoxon from Healthcare and Rehabilitation Services.
Good afternoon. I'm Heather Wilcoxon from HCRS. I'm the Assistant Children's Division Director. Nice to see everyone.
Thanks, Heather. And Dimitri Garter, our business rep.
Yeah, hi, everyone. I am on vacation, so I'm outdoors and also expecting a storm. So I apologize for my audio, but it's good to see everybody.
Nice to see the trees in your background. I hope you don't get caught in the storm. Who did I miss? Did I miss anyone? All right, well, that's a good sign. I am going to hand this to Flor for the next piece of business.
Thank you, Cheryl. Hi, everybody. I'm so excited about the next motions that we have, but I'm going to wait for Susanna and start with the minutes of May. So I'm looking for a motion to accept the minutes of May. Somebody would be willing.
Moved.
Thank you. Second?
Second.
Thank you. Heather or Jen? Oh, Janet. Yeah, okay. Janet. Any discussion? Any changes? Everybody had a chance to review them. I don't see any hands up. So all those in favor of accepting the minutes as submitted, please signify by saying aye. Or raising your hand.
Aye.
Okay. Any opposed? Any abstain? The ayes have it.
Flor, it's Renee. I'll abstain. I wasn't here last month.
Okay. Thank you, Renee. Sorry, I didn't see that. Okay.
Oh, and I forgot to mention, I think there was supposed to be a link to the recording, and I don't think that made it in the minutes either. Just a heads up.
Yeah, it was not working apparently, the link, but everybody got their written minutes, right? They were attached. Yeah. Okay. Okay, let's move now. So we are adding a voting member to the Building Bright Futures Advisory Council, and I'm looking for the following motion. The Building Bright Future State Advisory Council, at the recommendation of the Executive Committee, moves to elect Susanna Davis, State of Vermont's Executive Director of Racial Equity, to serve in as an at-large member to Advisory Council for the term of 3 years, ending in March 31st, 2025. Would somebody be willing to make that motion?
So moved.
So moved.
Okay.
We have a lot of movement.
I'm going to give it to Mike and second by Ruth. Is that okay? Just as I open it for discussion, I just want to say I'm super excited. I work with, and just like Mike, worked with Susanna in many different ways, and she is an amazing add-on to our committee. She's clear, thoughtful, and I call her unflappable. She can like end a discussion in a very wonderful way and make sense of a lot of like noise, and just really, I'm super excited. So with that, all those in favor of the motion as read, please signify by saying aye or raising your hand.
Aye.
Aye. Okay. Any opposed? Hearing none, the motion carries. Thank you, everybody. So I think I'll give it back to Morgan.
Great. It's awesome to see that we are staying on time, almost exactly on time. And we're really thrilled about Susanna joining the board. I know she wasn't able to attend today's meeting, but she now officially has voting rights on the board, and we are still recruiting for a parent member of the State Advisory Council. So if folks know of anyone who may be interested in serving as a parent representative on the board, we are actively seeking additional participation. So the majority of today's meeting is going to be spent discussing the final report from Vermont's Child Care and Early Childhood Education Systems Analysis. And this was conducted by Nasha Patel and Elliot Regenstein from Watershed Advisors and Foresight Law and Policy. And because this is the first time the entire State Advisory Council is coming together to discuss this, I do want to give a couple of minutes of background on what Building Bright Future's role was in supporting and facilitating the study. And we are going to break down into pairs. The State Advisory Council will be broken down into pairs, and then we'll actually have all of you that are on the call turn your cameras back on, and you will also be placed into pairs to discuss this for about 10 minutes, just to hear your reflections, and we'll post the questions into the chat bar for the things we want you to be thinking about. And then we'll bring the entire board back together, again, asking SAC members to keep your cameras on. And we'll have a more full discussion together about your reflections of the report and how we should be thinking about moving this work forward. And then at the very end of the meeting, we will have a 10-minute public comment period. So I'm going to ask one of my team members to put a link in the chat to the systems analysis materials. So for those of you who have not seen the final report or not had a chance to review at the very least, the executive summary, please take a couple of minutes to do that while I talk about the background. The goal of this study was to examine the systems that govern and administer childcare and early childhood education, and really be able to use this information to improve the system and figure out what recommendations would improve the functionality of how we administer childcare and early childhood education, and really be seeking to move towards optimal outcomes for kids and families. So within Act 45, or originally H171, the legislature tasked Building Bright Futures with overseeing and facilitating the systems analysis. So as Vermont's independent public-private partnership, our role was to monitor and facilitate the study. So we ran a rigorous procurement process, which resulted in the hiring of Foresight Law and Policy and Watershed Advisors. And that study just concluded in June 2022. You will find all of the information on our website. We tried to have a very transparent process. We compiled over 80 documents for comprehensive systematic document review so that these consultants would have a really strong understanding before talking to anyone about the current status of our system. And we also spent quite a bit of time orienting them to the project and what our expectations were for that project. We built a really diverse group of stakeholders to serve as the advisory committee for the systems analysis, and their job was really to oversee the process, make sure there was a really strong, rigorous methodology, make sure the study was on track, and again, make sure there was active engagement of stakeholders across all of the different sectors, and that we were providing multiple mechanisms over the course of the last year to make sure that everyone's voice could be heard. To do this work, we facilitated and convened 5 works in progress presentations where the systems analysis advisory body would come together with our contractors. The contractors would give a presentation, and then there would be open dialogue and discussion to move that work forward. One of the key points for folks who are not as familiar with the State Advisory Council or Building Bright Futures is that we do not directly support or oppose any specific proposal or bill in terms of how we move work forward in Vermont's early childhood system, but we're really proud of running a rigorous process that led to the recommendations that were presented in that report and in the final webinar. And we can also make sure you have a link to that webinar as well. And I think where we are now in terms of this process is very confident that all of our stakeholders, including the State Advisory Council, but partners across every community, are going to be able to come together and make deliberate, inclusive, and transparent changes to strengthen the governance of our early childhood system. So for those of you who have not had a chance to look at this report, I just want to call your attention to a couple of pages that might be helpful as you're thinking through having some interpersonal discussions about this. On pages 3 and 4 of the report within the executive summary, it's a 2-page executive summary, the consultants outlined their primary recommendation. I'm going to briefly read that, but it's on pages 3 and 4. So their recommendation was to create a new unit of state government that is focused entirely on early childhood, with a single empowered leader with oversight of a core cluster of key early childhood programs. This new unit should not be administered solely by either the Agency of Human Services or the Agency of Education. So again, that was the very consolidated recommendation that was in the executive summary, but starting on page 38, there's a very robust series of recommendations, almost 5 pages of how to think through building and improving early childhood governance in Vermont. So proposing a direction for the governance conversation, discussion of school-age childcare, data systems, and thinking about process for next steps. So again, really wanting to be clear that we are not asking the State Advisory Council or members to come to the table today and say, yes, we agree, this is the direction, and here's how we're moving it forward. That's not today's discussion, and we'll talk a little bit more about where we are. Today is really about honoring the process. And I think, again, Building Bright Futures was very honored to facilitate a rigorous process that ensured diverse stakeholder feedback. And I'm really excited that we were able to make time for the discussion with the full State Advisory Council today and stakeholders statewide to really make sure that we are using evidence and data to inform decision-making. And that ultimately we're using the VCAP and the vision we've collectively articulated to make progress and to be thinking about that as our gold star in really thinking about how we're improving outcomes for children and families. And just to make sure that everybody knows exactly what that vision is, in the VCAP, we've outlined that we want the Vermont early childhood system to be an integrated continuum of comprehensive, high-quality services that's equitable, accessible, and will improve outcomes for each and every child in the prenatal period through age 8 and their families. I also want to note that within Act 45, there is also a finance study, and the intent of that study was to build on the recommendations and build on the systems analysis. So just wanting to be clear that although BBF's formal role in facilitating the systems analysis is complete, we are committed to very closely coordinating our work and supporting RAND, which is the consultants that the Joint Fiscal Office have identified to conduct the finance study. So we've actually had our systems analysis advisory committee be invited to continue on. So there are folks that are going to continue to support RAND in their study as they're moving that work forward. So again, BBF's team is very committed to supporting that alignment and integration of these 2 studies. And we should all expect the finance study to be due to the legislature January 15th, 2022. So coming into this legislative session, so much work has been done to have really important data-driven discussions about how to support our early childhood system. So we're going to transition now into either pairs or trios and give you a chance to reflect on this report and the recommendations. So to the best of our ability, recognizing that some of our SAC members aren't with us today, we have put together pairs, and you'll have about 8 minutes with another member of the State Advisory Council to talk through your reflections of this study. Other folks who are here, we do invite you to turn your cameras on at this time, and we will be randomly pairing folks that are on the call today to have this discussion as well. So please feel free to turn on your cameras. A couple of housekeeping notes. If you are having any trouble, come back into the main Zoom room and Dora can help redirect you. And we're going to paste a couple of questions in the chat. So the first is, what's one thing that resonated with you in the systems analysis final report? And which components of the recommendations feel most important to you? So again, if you have not had a chance or you're unfamiliar with the report and where it stands right now, feel free to ask whoever you're partnered with some framing. Definitely take a look and pull up some of these documents. And when we come back to the full room, we're going to ask each of our SAC members to reflect on how their teams or their entities plan to use this report and recommendations in the coming year to improve the system. And so we'll have time in this order. So I'm giving you this heads up, SAC members. We'll start with agency leaders, legislators, and then private members of the board to share your reflections. And then just as a reminder, and if anyone has come on and did not hear this, we are going to have a public comment period at the end. So if you want to be added to the K for the public comment period, send Beth a direct message and we'll have about 5 minutes or 5 people be able to speak for 2 minutes. So Dora, I'm going to turn it over to you and Beth to be able to facilitate the transition out of the big Zoom room.
Okay, she's going to open the rooms. Hang tight, folks. Thank you.
So welcome back to the big room, everyone. I hope you had a nice session being able to connect one-on-one or, with a couple of people in the room. I do want to ask now anyone who is not on the State Advisory Council to shut your video off so that we can have some time of connection and discussion as a State Advisory Council. And those of you who are on the board, if you can turn your camera on, beautiful. If you can't, I see you, Renee and Janet Kilburn and a couple of others. So thank you. So what we want to do now is ask the State Advisory Council to share your current reflections on the findings. How are you thinking about this body of work in this report? How are you personally or your team and entity planning or already using this report and the recommendations right now and in the coming year to really think about how we're improving the system? So I do want to start with agency leaders' reflections, and just to state one more time for everyone, we are not asking the State Advisory Council members, either individually or as a board, to say, yes, we agree with this piece, and not this piece, and this is the direction we're heading. I want to hear your reflections on the report and how your teams are going to be using this, and have a little bit of discussion about this. So I'm going to ask our state agency leaders. So those that are on right now, Renee, Janet, Cheryl, and Sheila, to get us started. Any one of you, feel free to start.
I'm happy to start if that's okay. No one else is jumping in to cut me off, so I'll go. So I think, it has been a great process of lots of feedback along the way and lots of updates, which I think has been helpful when I think about DMH. We have a children's team of leaders who really work and oversee the children's system of care. So we have been talking about this report the entire time it's being built. And I've had a lot of dialogue with our Deputy Commissioner, Allison Crump. And I think for us, having this in writing and thinking of where the mental health piece really intersects with all young children and how we try to make sure we're staying up to speed on what is happening in the field, but also the experience of the families being most important. And I think when I think of our early childhood interagency coordinating team, which is one of our VCAP groups, it's been really nice in there to talk as folks from AOE and AHS about what we're seeing and how do we make sure we're continuing to communicate every step of the way as this moves forward, because I think, we don't know what the outcome of this will be. There are recommendations. I know there will be and has been and continues to be discussion in the governor's office, but also the legislature looking at this, I'm sure, are going to be very interested. And so I think for those of us that it with grants out to our agencies and really collaborate for direct service, that this really enables us to have a communication link. Like, here's what's happening, here's what we're hearing, how do we make things better, knowing that some things may move along the path. And we'll see how that evolves. But I think us staying up to date with each other is the most important thing, in talking about how any of these shifts then impact the services and what happens for families.
Thank you, Cheryl. Sheila?
I'm happy to go next. Thank you so much. We've been talking, again, just as Cheryl mentioned, the staff at CDD have been talking about this report since we very first heard about it. And really even before then, when we heard about the governor's initiative around the early childhood system and services. But I think what's important for us is that we were very clear and supportive that the Child Development Division staff really be engaged in this process if they wanted to, which many of them did. They had chances to speak individually with the consultants, and they joined some groups, and there are also the opportunity for them to share information in writing. And so we believe that everybody who wanted to really took the opportunity to provide input into this. And that's really important for us, because this is about our staff. And we wanted them to be well represented. The other thing that's really important for us is that this information, it represents the experiences and perceptions of our stakeholders, our families, our providers, and our partners. And that's really important to us. Some of it we knew, and some of it we didn't know. So we're committed to really looking at those experiences and perceptions right now to see where can we right now make some small changes, regardless of the decisions about the recommendations, regardless of what recommendation is finally supported by leadership. There's some things we can do about the information in the report. And that's the important part for us right now, because we have to come to work every day and do our job while leaders talk about these recommendations and possibilities. So we want to take the information that we can right now and look to see how we can improve the system for our stakeholders at this time.
Thank you, Sheila.
You're welcome.
Janet or Renee, anything to add before we transition to our legislative leaders?
I mean, I just hop in, and I was saying in the small room, thinking about my position in supporting Head Start programs statewide. This systems analysis wasn't really a shock, and if anything, for the Head Start community, it's like we do need more coordination within the system, because if for Head Start programs, if state programs are feeling this, and state kids and families are feeling this, when you add in Head Start and the fact that there's additional federal funding and federal regulations, for the Head Start recipients in the state, they've been dealing, kind of managing with this kind of issue for a long time in terms of a lack of coordination. It's really what the Collab office is all about, is trying to facilitate that coordination between state systems and federal systems. So for us to be at a place within our state where we're like, okay, even within the state system, things aren't as coordinated and working as smoothly as we need them to be for, on behalf of Vermont kids and families. I just think in that regard, anything we can do. And Sheila, I love your point about this is still information, and what do we have control over? Recognizing that this is a big body of recommendations, but what can we do with it in the meantime? I know certainly from the Collab office perspective, we're looking at this and thinking about what are the ways that the Collab office can support, again, helping Head Start programs navigate this federal and state world. Maybe there are some lessons learned or some gems about how we can coordinate these bigger systems that might be helpful in the long run. So,
thanks, Renee. Janet, anything you want to add from MCH?
Sure. I think the the thing that resonated with me, and it was a very comprehensive, you know, a lot of stakeholder input went into this, a lot of thinking, is the idea of how important leadership is. And the early childhood system is so complex, right? And this report kind of honed in on a certain segment, early care and education, Head Start included CIS, but then there's the whole health and public health, and we have pediatric healthcare and family medicine. And so it doesn't really include the entire system. And MCH remains committed to strong collaborative relationships across our entire system. That's really what we do to move the needle, and work around all these separate funding streams and the complexity of the federal regs, Part C, home visiting, Head Start, and whether or not we come together onto one state entity or we work across existing entities. It's really leadership that moves the needle and drives forward those collaborations and partnerships that then can be innovative at the local level and really make it better for kids and families. And we know that, and we know there are problems with our system, but we remain committed to support everyone in that work and be part of the solution. I know other states have sometimes created a single entity with mixed results. So I think the devil's in the details, and really look forward to building those stronger relationships across state government as we go through this process together.
Thank you, Janet. And before we transition to Jessica and Ruth, just wanting to say a very quick thank you to our state agency partners that continue to show up every single month. This has been a really rough year in terms of us saying where are their challenges in the way that we are governing and administering these programs, which is really hard on each of your teams. So thank you for being vulnerable. Thank you for continuously coming to the table and being able to share your perspectives, for allowing your teams to be actively engaged in the process. We really appreciate all the work that you're doing. So thank you. Jessica and Ruth, I would love to have you both do a couple minutes of reflection each on how you're feeling about this and what you're anticipating moving forward.
Do you want me to go first, Jessica, or you want to go?
You're the senator. You go.
I don't know what that means, but okay. Hi, everyone. Ruth Hardy, Senator from Addison. But it's really interesting to hear the state agency perspective, because so much of what is going to be possible depends on the state agencies and what the leaders in current state agencies are willing and able to do together, and what you all are able to implement at the state level. And that will drive a lot of what the legislative conversation is. So I'm thinking a lot about what are state agencies able to do, but then also how does whatever we all decide to do impact the local level and the families and the kids at the local level and the staff at the local level. We just implemented the new state level database, and that had pretty rough ripple effects on some local level agencies. So whatever we all decide to do will have an impact, and I want to make sure that we think it through well enough to make sure the impact is positive for families and kids, because they have so much going on right now that if we do something that makes their life harder, that's not going to benefit anyone. I'm committed to working on this throughout the fall so that we can get started right away in January. And a big part of that also, though, will be the financing study. And that's what I'm really looking forward to. How do the two studies dovetail together so we can create a system and then fund that system? Because we can make all the administrative changes we want, but if we don't have the right funding structure, that will not help the matter. So those are my current reflections. Thanks.
Thanks, Ruth. And I am in total agreement with what Ruth just said. First, I would say, though, as far as our little meetings that we just had, which was fantastic, I'm really pleased that I had an opportunity to get to really know another member of our group that I hadn't before. But the best thing for me was the study was reaffirming of so much that we hear in the community among parents and childcare providers. And being a member now, a House member for, this will be my going into my 7th year if I win, and hopefully I'll win considering no one is running against me. But the thing that is just incredible is, you know how often you hear people whispering or they tell you something that you hear in the community and you wonder, is everyone feeling that way? Like, I've heard that here and I've heard that there. But the thing about the systems analysis for me that really resonated was, yes, what we are hearing is real. And there are people unhappy all over the place, both in, from the different rules, how we, if you're in the Agency of Education, you got to do one thing. If you're in the Agency of Human Services, you got to do another thing. The part that worries me the most is, how do we come together? And the really nice part about page 38 is, here are some of the things that we have to work through in order to come together and collaborate and build a consistent program that makes a lot of sense. I think the most important to me is figuring out a way to balance the governance with the financing, and knowing that financing, we've still got some time before we're going to see that report. And so we've got to work on getting the governance in place. As a legislator, I'm thinking a lot about, how do I talk with some of my colleagues that I know will be on the Appropriations Committee and the Ways and Means Committee. How do we make sure that we're moving in a direction that they agree with, so that when we hit Montpelier in January, we hit running, so that when the financing analysis comes in, then we can all talk about that, because that honestly will scare people. We all know it's not going to be cheap. And so we really need to, this systems analysis couldn't have come quick enough. And I'm so pleased that Building Bright Futures helped us get it done actually a little early, which is unheard of in the halls of the Vermont State House. So I think that all of those things are going to be really important. And if there's anything that I would most agree with what Ruth just said, is that we are committed to working on this and doing things as quickly as we can, but we also need to be really careful, because families, children right now are being hit with a lot. We're still coming off of COVID, and now we have monkeypox too. I mean, we have lots of things that parents and families are juggling and trying to figure out, and we still haven't filled all of our vacant, we've got a lot of people on waiting lists in a lot of places. And so then we have the Supreme Court decision that says maybe we can't all be in the same system. And so there's a lot to balance, and we're going to need every single person here to help us to do that. But I'm already talking to Legislative Council, and I know Ruth is as well. And we're going to just keep working on it, and we'll make some mistakes, and we're going to look to you to point those out to us, so that we can keep moving forward and not have anybody go back into their corner. I guess I would say, let's keep doing this together.
Thank you. Thank you both. I really appreciate you being able to outline your commitment to this work, and that the SAC can be a forum for us to have those discussions and bring some of these things into a public forum. Quick note for everyone on the call: we have not had anyone reach out to say they wanted to provide public comment to the board. So we're going to keep going with our private partners of the board to keep going around reflections. But if folks are interested, please send Beth a private message, or you can raise your hand. So I want to open the floor for private partners to do the same reflection, and go ahead and just raise your hand, and I'll go in the order that you come up. Mike.
Yeah, thanks, Morgan. And I wanted to just tag in, because I had a really nice chat with Jessica, and it's the first time that we had met, and we had lots more to talk about. So it's a good thing Zoom called us back. I also want to underscore the complexity of the challenge in front of us and its importance. Supporting young people is relatively obvious, I think, especially to this group of folks. And its importance is relatively self-evident as well. I've been a school counselor and a school leader for a long time, and kids and families struggling is not new. I will say that I'm worried as much or more than ever. I think the impact of inflation and mental health challenges that are exacerbated by the pandemic are going to continue to be felt across the state. And I've had some specific instances of that already this year, with school leaders emailing me like, hey, do you know about any grants? We've got so many kids already that we're worried about that just don't have shoes and don't have what they need to get school started, and homelessness or being without a house. So the VPA, the Vermont Principal Association, has long been an advocate and will continue to be an advocate for 4-year-olds having the opportunity for full-time preschool, early kindergarten, and the resources that are necessary to go along with doing that well. And the report, I think, was affirming, as Jessica said. It's like, oh, yep, there it is, just kind of what we thought, quite plain, in plain language. I think they did a really nice job with the executive summaries and the recommendations. And I think clear, collaborative regulatory processes are one of the things that jump out for me, and I think will be appreciated by our members as they work to integrate the young folks into the school systems, just to be able to have one regulatory agency to report to, or at least a coordinated approach, I think would be really helpful, and that comes through in the report. That's probably enough from me. Thanks.
Thanks, Mike. Others?
I'll follow Mike. Thanks, Morgan. So as I'm going to tell you more or less what, like I was saying to Sheila, because the school board takes July off. Mostly, we haven't been able to really discuss because of the timing of the report. So we've been discussing it in like a smaller group, but it's not a representation of us as a whole having the time. So I'm looking forward to, obviously supporting this, but really going in deeper conversations. The report, like Mike said, was reaffirming of things that we're hearing before. I was excited to see that they took the time to also look a little bit at the 12-year-old, that range too, how that affects in one of their recommendations. I think was also on page 40 something around there, that how the system as a whole has the same needs and for resources and for more clarity. But I'm interested in seeing what story are we going to write. We have this big narrative of all this information data that we call what are resources that we're going to put in, where the legislature have a lot of turnover for next year, right? There's going to be a lot of relationships that need to be built, how we're going to be able to create a new agency that has the resources and the staff necessary to provide the services that we're looking for. And as educators and all of us here, in service for kids, they don't have a year to lose, right? So we'll just continue to do what we're doing. So what can we do with some of the information that we have right now that we could do now? I'd be interested, even before the new agency is created, do now with some of this information to help. And then the last thing that I would say is I'm always interested in, because part of what we do in different agencies goes back into politics sometimes, right? Especially in the environment we are right now. And we keep saying that a lot of things would be to the whim of the governor, right? Or whoever is in power. But at the end of the day, is what is best for kids. And that's why we all are here. But there's a tendency to think that, we can't have this honest conversations completely because we're worried about what, some bigger powers. And hopefully this report after the pandemic could shake that off a little bit and be able to truly do, write a new story for our kids in Vermont that is more inclusive. And I'll stop.
Thank you, Flora.
I'll hop in. Oh, Katie, do you want to go first?
Becca, let's keep going with SAC members, and Kate, I'll note that we will include 2 minutes for you as soon as we're through.
I think for those of you that don't know, so I'm an Act 166 coordinator for 10 supervisory units down kind of the central part of the state. And this report is, as many of us have said, is kind of the like, oh, yes, there wasn't actually anything really new in it. I think the piece that resonated the most with me was where they acknowledged that it wasn't easy or perfect, but was the opportunity with the most potential benefits. And I think as we go forward, that's going to be really important. I think the other piece for us right now, in terms of my role, again, like Flora said, right, like it's July, it's not a great time to meet with all those superintendents, is making sure that people are aware of the work. And then really figuring out what our roles are, right? As this pre-K coordinator in community and public settings, right? We're in this really diverse 2-parent system. And so how as we move forward, what does that look like? And what sway do we have as the people who are the receivers of this really great report?
Thanks, Becca. Dimitri, and then Janet.
Yeah, thanks. So, I'm probably one of the few people on the State Advisory Council who are not working in some subsystem that's part of the existing structure, which, I'm probably coming from a fairly unique perspective in that regard. So, it may or may not be valuable to hear my perspective with that context. But one of the things that really struck me about the report is the extent to which the report's conclusions and its options were constrained by status quo, namely how far away we can get from existing status quo. And there were even some caveats in there regarding, something to the effect that the report may have gone further were it not for considerations around things that really probably couldn't change. So that framing, I think, is really important to understand because as Janet pointed out, I think it really does come down to leadership in that sense, and that there's enough leeway in the report where if the choice of leadership is someone who's very comfortable with or motivated by continuing to maintain status quo, that may be what we can expect. Whereas if the choice of leadership is someone who's very motivated or incentivized by a substantial change, that can make a real difference. And the thing, Representative Brumstead spoke about the finance study, and yes, we are all holding our breath. From the standpoint of the business community, for what it's worth, the business community is also frustrated by status quo and willing and calling for really bold change. And one of the reasons why I'm here, and one of the reasons why the business community is really motivated to be a partner to help see universal pre-K get passed in Vermont, is we really think that it's time for a more significant move on this than just nibbling around the edges. I think the report is very encouraging in that it seems to be following that trend as well. However, with the caveats, there are a lot of ways that we can see things continue to move slowly and incrementally, which could be a real challenge. And from the standpoint of the business community, the worst case scenario would be a finance study that gives us sticker shock combined with a system that doesn't really change very much. So there's willingness to take risk on the part of employers because we realize that standing still is perhaps the most risky thing. The cost is not the only issue. I would frame it around how much of the system is willing to change and how much real bold action we're able to and willing to make on this. So I hope that's helpful.
Thank you so much, Dimitri. Go ahead, Janet.
Yeah, I was just going to offer that with Vermont AUIC, We really see our mission really focused around advancing equity and excellence in early childhood education. And I think that is really like the shared purpose that came through in this report. And like there, like sort of as Mike was saying, like there's shared agreement around that in the state, which is thrilling and sounds different. I mean, it sounds like from talking with the consultants, it's different than sometimes they hear in other states. And so I really hope though, as we all move forward with this, like that we are keeping that, those big goals in mind, even as I think that this report really helps, will help me in communicating and discussing with our members around the complexity associated with this work, right? Like it's really complex to think through how do these funding streams and administrative structures, like how do they come together? Like our state leaders are doing a lot of important work around figuring those pieces out. And part of what we need is that the part that's most exciting and that our members have been most excited about for me is the idea of sort of a single empowered leader, that person that can figure out how to marry sort of the content expertise with the administrative expertise and the leadership skills that are needed to like set that vision and move towards it. Knowing that all of that is going to bring us just to the sort of the good governance values around transparency, accountability, efficiency, that it feels like, the report sort of lays out as some of the benefits that we're going to get, and that I think need to be some part of the additional goals that we have as a system overall. Again, I think we really do share these goals around, equity and excellence and wanting to serve each and every one of our children, as they are with what they need. But we also need good governance, and I think this is this report can really help guide us forward. And again, like I said, help me in these conversations also really are helping myself and my board and our members have more robust conversations about what is it that we truly do need from state systems and from governance. We can't just say, we don't like the way it is. We need to say, this is the way, here, be a part of the solution. So.
Thanks, Janet. Any other state advisory council members who have not had a chance to speak want to make any comments?
Sure, I'll comment. I found the report really fascinating. I feel like I'm still kind of digesting all the information in there, and it definitely emphasized for me just how complex the system is, and if it can be overwhelming for providers and system leaders, how that must affect our families that are trying to receive and access the services. I feel like there's such a need for this one super strong leader that has all of these skills, and I try to picture what that person might look like and how their background and theory might manifest. And it's just kind of interesting to think about. I think, in the meantime, for myself and my team, I think continuing to try to break down the silos that we can within the community level to help families make the connections that they need to and have their needs met within the existing structure. I feel like that's something that we definitely want to continue to build upon. Like the better people understand at the local level what the services are and how to help people connect and break through those barriers, I feel like will better serve the community. So thank you.
Thanks, Heather. Any other comments from the SAC before we transition?
I just want to note the raw honesty of this, and the frustration that you could read in this, and this really good place that it was coming from, that you could read it and take it as, okay, this is a group of people who are frustrated because we care so much about kids and families, and how sometimes we can butt against each other and get pretty upset with each other, but ultimately we have that same goal of putting kids and families at the center, making sure that they're healthy and thriving. And so I appreciate that this laid out and was very transparent about that frustration. And also, and people talk about the complexity of the system. When we say early childhood, people automatically think about childcare. That's kind of the first place we go, but this really laid out that this is complex web that includes childcare and all of these other pieces that support kids and families. And that this idea of this kind of strong leader, and for me, as the PCC and the PCC network, is reminding, you know, if that's the direction we head, that person or that entity about what's really happening on the ground with families and what the scope of services are for families and how complex that system is. Because I think sometimes that's lost when we get people in higher up bureaucratic positions, because you're just not on the ground and you're not aware of all of the moving pieces that are making things happen for families. So I just appreciate, I felt very validated in reading it, and appreciated the honesty and seeing that, having that frustration named, and know that it's coming from a good place.
Thank you, Amy. So I want to take the last 2 minutes and open for public comment. I believe Kate Northey is the only one, Dr. Kate Northey, that wanted to make comments, but we'll also hold a couple more minutes just in case. So Kate, go ahead.
Thanks. And I apologize for stepping in earlier. I misunderstood. I really enjoy this report. I'm really glad that it exists. I love hearing everybody's thoughts, and I'm really just going to echo things that people have already said, right? This desire to have strong leadership is an essential component that I think we need to move forward, and that leader needs to have early childhood expertise and knowledge, political expertise and knowledge, and system expertise, so they can continue to build and sustain a system that's effective and efficient. We have so many talented people at the state level, and just thinking about getting them together to work in a place where they can collaborate more, they can coordinate more, that's going to improve things for children, families, educators. It's going to make for more unified subsystems of early childhood within the field. And I think it's just going to align with so many of the other initiatives that we have and are hoping to move forward in the next few years. I think we have talked about attention and a difference in philosophy that's often communicated between different sectors within the field. And I think the more that we can, in our daily conversations with people, emphasize the shared philosophies of putting children and families first, the better. I think that will serve us, and it will make this a less scary process for people. The only other comment that I'll make is, we talk a lot about this one leader, but what I love about this approach is that it actually leaves space to build early childhood leadership capacity within Vermont. We don't have a lot of opportunities to lead, and thinking about having this new entity with an elevated political voice, all of a sudden now we have a whole new pipeline to leadership and a whole new way to represent our field at the state and prepare people to be advocates. And I think that that is really exciting. So I'm curious to see how it shakes out.
Thank you. And Kate, can you just introduce yourself for the board really quickly?
I'm messing this up. I'm so sorry. My name is Kate Worthy, and I'm an assistant professor of early childhood at the University of Vermont.
Thank you. All right. So I know that we're already at time, just wanting to recognize with this board and everybody who's on the call or who will watch this later, that this is the first of many discussions for thinking through how we're going to transform our system, right? We have the finance study coming, the systems analysis is complete, but we're about to have a much bigger discussion of how we think about using this data to inform decision-making. And just wanting to say that as the public-private partnership and the state's independent entity that is specifically charged in statute to monitor the system, our job and our responsibility is to ensure that those in decision-making authority have the information they need to make decisions. And that includes data, but it also includes elevating the voices of families, of communities, and all of the state partners that care about kids and families. I also want to recognize that our role as a state advisory council network may shift slightly as the state determines their path forward, and we're ready to adapt and meet that need. And where things won't change is how we support the state in monitoring the early childhood system. And so our role over the next year, the next 5 years, is really going to be thinking about supporting early childhood governance transition. So again, aligned with our role in statute, both in terms of advising and monitoring our job is going to be to be an entity responsible to support the state in transitioning, in developing transition plans, in monitoring those transitions over time, in thinking about how we're defining and measuring success, evaluating progress towards these goals, mapping it to our strategic plan and seeing whether or not we're meeting this vision we've collectively developed. Making sure that we have outcomes that are time sensitive. So measuring what we can right now and recognizing that some of the big change that we're looking to make, we'll see that impact much later. But really thinking about how we support the state in continuous quality improvement and thinking about how we're moving forward to support outcomes for kids and families. So thank you all for being here today. Again, the first of many conversations that we'll have in the State Advisory Council, but also with public and private partners. Thank you for joining us. We will not have an August State Advisory Council meeting, but our next meeting is September 26th. So we will see you all then. Thank you.